Hughes. Last week I was very fortunate to host an event in Parliament actually for an organisation called Patient Safety Learning that I'm sure you're aware of, a national charity, and spoke to many professionals and patients and families of patients. And I was just interested to get a sort of almost a succinct, almost elevator pitch from you of what you see your role will mean to them and to patients when you or should you take the role.
Well, if my nomination is approved, I would look to work collaboratively with all of those groups and find shared objectives. I believe we do have shared goals. In fact, I spoke to Helen Hughes and I was very grateful to speak to her because I believe that her work has been absolutely phenomenal. One of the things I would say is that the time is right for change. People want change. They want the right things to happen. I think there are problems in the system which sometimes prevent that from happening, but as I've said, there are also attitudes, behaviours and cultures which are just completely wrong that need to change. So my elevator pitch is that I will work tirelessly to support patients' voices, to ensure that patients' voices, their views, their experience and their expertise is included in all stages so that we instill a culture of safety from the design to the delivery of healthcare.
Thank you. And may I ask, what do you foresee the barriers being to that at the moment? Obviously, everyone I speak to in the NHS, they say that patient safety is at the heart of what they do. They care passionately about patients. Many, in fact, everyone I've ever met who's gone into the profession is for that reason. So what is it that you think will be the barriers that you've got to overcome or perhaps break through to make sure you can deliver on that tireless effort?
So the barriers, I think, to patient safety are not dissimilar from the barriers to staff speaking up safely, and that includes psychological safety, it includes conflicts of interest, communication, and information being learning and improvement. I think another barrier is the complexity of the health system. In the NHS alone, there are tens of thousands of organisations, and within them they have their own cultures. There's something about people's desire and willingness to act at speed. There's also something about the regulations. And working with regulators, as I have in the past, I would say that regulators who are forward-thinking and modern want to work to the maximum of their regulatory powers to get things right for patients. And I'm really pleased that in the time that I was National Guardian, I worked with the CQC, who included it into the well-led inspection. That is fundamental in terms of improving the outcomes for patients, but also with professional regulators who are really becoming, I would say, more modern in their approach.
And may I ask one final question? Do you see the primary challenge that you might face being an operational one or a cultural one? I mean, and how will you address either?
I think they're both huge. I think this is a monumental task, and I don't underestimate the challenges that will exist in this. I also feel that culture, people say it takes a long time to change cultures, but in my experience, it only takes a long time if people don't change. Operationally, I need to understand the scale of the problem to create the right operational framework so that when people do raise matters, they can get a response and a timely response and a warm handover if that's what's needed. But I also know that bringing people together is often the best way. As you were saying with your reception, bringing people together and understanding their needs, their roles, and what they can do to make a difference is the best way, I think, to move forward.
Thank you.